Good day, everyone. We are Group 2, presented by Ashley Catalon and Austin Villaflor. And for today's topic, we assigned to discuss a kind of drug, methamphetamine. So let's start. What is methamphetamine? It's a powerfully addictive stimulant that dramatically affects the central nervous system. The drug is made easily in clandestine laboratories with relatively inexpensive over the counter ingredients. These factors combine to make methamphetamine a drug with high potential for widespread. Methamphetamine is a crystal meth, resembles glass fragments, and is an illegally altered version of the prescription drug that is cooked with over the counter drug in meth clubs. A clandestine lab is a secret or concealed location where criminals produce or prepare a synthetic drugs. How is methamphetamine used? Methamphetamine comes in many forms and can be smoked, snorted, orally ingested, or injected. The drug alters the mood in different ways depending on how it's taken. The preferred method of using this drug has changed over time. Smoking or injecting methamphetamine puts the drug very quickly into the bloodstream and brain, causing an immediate intense or rush, and amplifying the drug's addiction potential and adverse health consequence. The rush or flush lasts only a few minutes and is described as extremely pleasurable. This methamphetamine is a highly pure, potent, and low price. Methamphetamine ingredients such as pseudoephedrine, a common ingredient in a cold medication. Immediately after smoking the drug or injecting it intravenously, the user experiences an instant rush or flash that lasts only a few minutes and is described as extremely pleasurable. Snorting or oral ingestion produces euphoria, a high but not an intense rush. Snorting produces effects within 3 to 5 minutes, and oral ingestions produce effects with 15 to 20 minutes. Methamphetamine effects. The effects of methamphetamine is characterized by wild sleeplessness for days and weeks at a time, total loss of appetite, extreme weight loss, dilated pupils, excited, talkative, delude sense of power, paranoia, depression, loss of control, nervousness, unusual sweating, shaking, anxiety, hallucinations, aggressions, violence, dizziness, mood changes, blurred visions, mental confusion, and agitations. As a powerful stimulant, methamphetamine, even in small doses, can increase wakefulness and physical activity and decrease appetite. A brief intense sensation or rush is reported by those who smoke or inject methamphetamine. Oral ingestion or snorting produce a long-lasting high instead of a rush, which reportedly can continue for as long as a half day. Both the rush and the high are believed to result from the release of very high levels of the neurotransmitter dopamine into areas of the brain that regulate feelings of pleasure. Here are some kind of example of the methamine effects. In the first picture, loss of control. The second picture is like violence or abusive. And last is mood changes. Methamphetamine production is also an environmental concern. It involves many easily obtained chemicals that are hazardous, such as acetone, ether, red phosphorus, and lithium. There's a short and long-term effects of methamphetamine. The short-term effects of methamphetamine: increased attention, decreased fatigue, increased activity, decreased appetite, euphoria and rush, increased respiration, and hyperthermia. The long-term effects will be discussed by Ashley Catalon.
So, in this slide, we were going to tackle about the long-term effects of methamphetamine. Means a problem that is caused by a disease or treatment of a disease and may continue for months or years. So, long-term methamphetamine abuse has many negative consequences, including addiction. Addiction is a chronic relapsing disease characterized by compulsive drug seeking and use, and accompanied by functional and molecular changes in the brain. These effects includes dependence, which is a condition in which a person takes a drug over time. First, addiction psychosis, which means experiencing delusions or hallucinations. Paranoia means giving an altered brain chemistry and can bring on paranoid thoughts, feelings, and behaviors. Mood disturbances. It is like a feelings of distress, sadness, or anxiety. And lastly, and muscular motor. It will result from repeated motions performed in the course of formal work or daily activities like, for example, hand flapping, twirling, repeating phrases, manipulating objects, banging toys together, and repeatedly pushing buttons. It can also lead someone to due to stroke. Drugs of abuse increase the risk of both ischemic stroke and intracerebral hemorrhage. Lastly, weight loss. There are many contributing factors beyond a plain lack of appetite. Weight loss due to drugs relates to changes in eating habits, metabolism processes, and overall lifestyle in people struggling with drug addiction. In this slide, it says here that the symptoms of taking too much methamphetamine, that most of these symptoms and effects are already mentioned before this slide, especially when it comes to change of behaviors, and that includes the paranoia, hallucinations, mood disturbance, and delusions. It means something that is believed to be true or real but is actually false or unreal. Methamphetamine belongs to a class of drugs known as stimulants that has an effect on our nervous system. So when someone uses this drug too much without the prescribe of a doctor, someone will use this as their medication with the prescribe of a doctor, but yet they stop taking this drug without the doctor telling it to them. It can still cause a psychotic behavior such as paranoia, hallucinations, and other effects that we mentioned earlier. Next is medical complications of methamphetamine use. So as you can see in this slide, methamphetamine can cause a cardiovascular problems. This includes rapid heart rate, irregular heartbeat, and increased blood pressure. So taking too much of this drug or this methamphetamine can even cause a heart failure that can lead to death. Methamphetamine is a potent stimulant with high abuse potential that can be smoked, snorted, injected, or taken orally. It has many symptoms and effects on the body and health of people who will take too much methamphetamine. So if someone takes too much methamphetamine during pregnancy, it can cause a prenatal complications such as increased rates of premature delivery and altered neonatal behavioral patterns such as abnormal reflexes and extreme irritability. So it is also important that we should have knowledge of the symptoms and effects of using this kind of drug that instead of being used to treat illness yet can even cause the death of a person due to using too much of this drug. So that's all, and this is where we end our discussion. Hope you listen well. Thank you and have a good day everyone.